stuck.
You're now stuck. So this is the incomparable Heather Flannery and Jim Nasr, and they're here at the, what event are we at today?
Unlocking Blockchain, organized by General Dynamics Information Technology.
So I've just ambushed them so that they can tell me 3 minutes about what they're working on here for healthcare and blockchain. Who wants to go first?
I guess I'll start. Yeah, so we're here to really do two things. I think one is to help people understand where blockchain is in relevance to healthcare and some of the initiatives that are happening there. And the other thing is really how to go forward. And part of our thinking really is that there's already existing technologies, particularly open technologies that exist that allow you to kind of get there, and that blockchain really is, it's not magic. It's a part of, I think of it as a theme park, as a playground and theme park. It's part of the theme park, but by no means the entire theme park.
That is a really good analogy. I like that, Jim.
Thank you.
So what about yourself, Heather? What are you here for?
Yeah, it's interesting. I'm co-leading the health track with Jim, which is really exciting. And Jim said it's not magic. I like to say, as you indicate, Samson, it's also not hot sauce. Blockchain is not hot sauce. It's a meme. So we're each going to be giving a presentation and then facilitating an audience discussion. And I'm going to be digging into our barriers to adoption for blockchain in terms of global health, clinical trials, a wide range of use cases. I'm going to be describing a new 501c6 membership organization called Blockchain in Healthcare Global that is being launched next month as part of the IEEE organization, the ISTO, the ISTO. So we're going to be talking about how that can drive industry maturity worldwide. We're looking forward to it.
Excellent. I was actually going to ask you to give me 30 seconds of a shameless plug. So give me 30 more seconds about IEEE 506C thing you're working on.
Sure. It's a nonprofit organization that is under the ISTO. You can go to IEEE-ISTO.org to see the way that it is structured. But essentially, it's a nonprofit trade association where healthcare delivery organizations, global health organizations, and companies that are seeking to commercialize or advance open source projects can come together to work collaboratively on the barriers that impact all of us that are involved in this space. The premise is that rising tides lifts all boats, and we need to work together if we wish to overcome a wide spectrum of significant challenges.
Cool, awesome. Jim, do you have anything you want to shamelessly plug?
Absolutely. Yeah, so as I mentioned a little bit earlier, I'm a big proponent of open technologies, and in my prior life at the CDC, I was there for the last couple of years. We developed this set of open technologies that we are now calling Open CDC. That'll be pushed out to the public domain, is being pushed out to the public domain. In my current world in life sciences, I'm building an equivalent called Open Pharma. So Open Pharma, very much the intention is a number of open APIs that are available for anyone to use. Lots of data sources are available, very sophisticated de-siloing technologies, and most of this will be available to anyone to use for free. And really the whole idea is that the healthcare industry, healthcare life sciences, needs a rethink about using open technologies that are interoperable by design to move forward, as opposed to many of these closed and kind of large-scale proprietary systems that currently permeate the industry.
Cool. Clearly, I just found out that Jim used to work at the CDC and has something for Open CDC and Open Pharma, so we'll have to schedule an interview when I'm not ambushing them in the middle of their preparation. But before we sign off, how can we get in contact with you if someone wants to get in contact with you?
Sure. Lots of ways. LinkedIn, on Twitter, I'm at JNasr, JNASR, or jim.nasr@synchrogenics.com. Many ways.
Can you spell synchrogenics for us?
Sure. SYNCHRONGEIX, I think.
Yeah, it's always a spelling test with me.
Yeah, I know. I can. Much easier to go to Twitter, JNasr, JNASR.
Brilliant.
Yeah.
And Heather, your contact info?
Sure. I'm Heather Flannery on LinkedIn. That's really easy. My email is hflannery@blockchainandhealthcare.global. And also on WhatsApp and a range of other communication modalities, but I'm not really a Twitter person.
Oh, we're gonna have to get you on Twitter.
I know.
So thank you both for letting me ambush you, and I'll let you get back to preparing for your presentation. Bye.
Thank you.
Thanks, Samson.